Hello, everyone.
Hello, everybody. So, I think we are just in a race of gathering.
Yeah.
I'll just give some few minutes, then I'll
Okay.
start with the things today. It's a very unusual but a very interesting talk that we are going to have it for the day, which is obviously meant for man and woman, both, especially because you might have heard about it, you might have experienced, but you may not be aware. So it's one of the strategy of the depression in a young generation that we are taking it ahead.
Okay.
Hello everyone. It's recording Manisha ji. So whenever you're ready
I'm
and you would like to
ready,
start.
and I was just waiting for the people to come over and together. So today, let's start with the things in another series. I think we were supposed to do it last time, but we all Arogyams were busy with my team and everything. So now let's start with the things about what is depression when you are facing when it's a pregnancy time, which is people must have experienced, people must have gone through. It is called as postpartum depression or postnatal depression, which is obviously found in a woman. Of course, it is observed even a man as well, but there is a lot of work to be done in this case. This is a very recent and a new part, which I would like to cover today as in general, because many of you must have gone through. Pregnancy is not a curse. Pregnancy and having a child is just a joy. And to raise a child is an another joy. It's a perfect motherhood that a woman and a man and a woman, both of them, they enjoy and they can share and they can cherish in their life. But there are few unhappy episodes which happens in someone's life that for them this particular uh, enjoyable moment becomes a little bit depressive moment. And why it is like this and what are the reasons? See, generally we call it as it's it is called as the postpartum depression, which is a very which is generally called as a depression or a postnatal depression after pregnancy or depression after the childbirth. Now, after the childbirth, so many times it happens that the mother is going through depression because of so many past reasons, so many other factors which are affecting, and there is no as such a particular medications, but still so many of them they have got it. Nearly 10 to 12% of the ladies over here in our development or developing country, they are facing this. And then if it becomes little bit severe, it is very dangerous that they become a child killer. So this is one of the dangerous part and why we are having it. You must have gone through these all, maybe any one of you, but you might not be aware about it. That what is the postpartum depression or a postnatal depression, and why I was going through and why I was being taken a care about and all that. This is one of the things. So now let's take. It is basically um, emotionally you are totally down, very low. You are consistently like nothing is left out it's a joyful moment when you're having a baby, when you are sharing some joy of your own. You have to play with the baby, you have to nurture the baby. And in that whole era, you are not that excited, you're not happy, but you are very, very sad. So this is one of the very big thing. Secondly, sometimes you are very angry if the child is crying. Sometimes instead of a caring, instead of finding the reason why my child is like this, you are getting angry on the child, or you are getting angry on the surrounding, or maybe any of the thing that is putting you in the mood. You may be low, you might even start crying, or you might even have some sort of a feeling that no, this is not right, this is not a, like a disgusting feeling, these kind of a thing. And that is keep on changing every now and then. Or this mood become very temperamental, aggressive, like sometimes you're too high with the aggravations and all that, and sometimes you're not at all like that. Sometimes you are frustrated with these kind of a consistent era of children and their irritability and their nature. So these kind of a thing, sometimes you're restless because child is not sleeping, you don't get the sleep, you are used to the routine work which you are not allowed to do it. So that's one kind of a thing which is there. And sometimes, oh, you get the hopeless feelings that now I've got no other way than to bear this because I've got it. And that puts you into the low mood and a depressive conditions. And with this consistent every day of a life and this, sometime you put yourself into why I went with the children, why I have to give a birth to the child. One thing you make sure in your mind that having a child is one of the biggest joy and a joyful moment in the life of a mother, to become a biological mother. And then having these negative feelings for a child is not right. There is something which is there. Of course, you might be highly professional, like we people are professionals, but this kind of a thing is little bit, you feel it, it's not right. Then sometime you feel it, oh God, what a shame of the life. Why I did it. I'm such an intellectual person. And this is the negativity you are building towards your pregnancy, towards your nurturing, towards your delivery, towards your child, raising everything. And this happens. It's not just one thing. It happens in these developing countries and even undeveloped countries. So I'm going to take up this with the symptoms, why everything. Then you get tired. Tiredness is one of the things. God, what a big job I have to do. What a dirty job I have to do. Then, because of that, what your basic brain is towards the particular pathway of your routine life, it doesn't get. So, your mentally active brain becomes little bit down and low. So your power of motivation decreases. And then you you can't argue out. You are absolutely you can't come up in a proper way to get a proper bonding, proper love, proper nurturing, proper care. When it's a one baby, she needs what? She needs a care. She's a little young, very sweet, tiny, loving child. What do they need? They need just a care. They need a love. They need a nurturing. And that you can't have. And then you get emptiness. Oh God, my life has gone so diversified, so empty. That's a negative feelings that you are totally building, building, and building. And that is why, secondly, you feel it worthless of the life. Oh, what is the use of this? This is what I'm looking for. This is what I've looked for my life. This is what I am for. And that all the thing will make you to have a difficulty with creating a bonding between yourself and a baby. Baby is very, very sweet. Everything is fine. But you can't have that love, that affection, that bond, which is very important. Because when a child is out in this world, what do they see? They see the first phase is a parents, father and a mother. And this is happening not one, it happens even with the father too. Father is finding it because the mother is like that, father is disturbed. And that is why this depression is something unusual. And this has been observed so many times here around in the gynecological wards in mothers. And then sometimes, it's like sometimes some mothers are so emotional, they are overwhelmed. And that overwhelming is also sometimes creating a trouble in their life. That, oh God, so precious, I can't take care of such a tiny little sweet angel. And that's where they get, and they get into trouble, they put themselves into trouble. So it's like, both the ways. Sometimes you're putting yourself into extreme position. Sometimes emotionally you're putting into the totally two extreme caring positions that you are totally nowhere. And sometimes you feel, oh God, what have I done? I should not have done this. This is like a self-harming situation. I shouldn't have given a birth to such a nurtured, such a beautiful angel I shouldn't have brought them in the world. I'm not worthwhile because I can't take care of the child. And that's where you put yourself into self-harming position. And that is why, you get a lot of problems and all that. Now think about this. That's a one side of your emotions. Your emotions are totally different. And this happens. Why it is happening, I'm coming up to that. But this is happening with many, many, many women, including a man as well, because when her wife or her better half is not in a proper mood and not working or not doing the things how it should be, then of course the spouse is bound to have a trouble. And they themselves also try to create a bond because it's a tiny baby to take in a hand, how to hold, how to look after. So they also go into depression. So a young child, this happens till first year, and then it comes up slowly and slowly. Sometimes it goes on for a little longer period, but mostly it comes down after a year or so, where since the child starts little crawling, walking, all that, then that depressive feelings little bit it decreases, and it goes away completely because they get used to it. But this depression is an unusual kind of a depression. And then, because of this kind of a thing, it is happening in two ways. always remember this postpartum depression or a postnatal depression is happening in two ways. One is in the extreme upper grade or upper class people or upper grade country and all that. But there, it is, the thing is they are well developed, they understand, they're highly qualified, or they are not illiterate, or they know how to fight, or they are being trained how to fight. So because of that, in those kind of a countries, in those kind of a people, this kind of a depression is such where it's they can understand that here is a baby. Or what happens nowadays in that class of the people, it's been found as a 7 to 12% or 15%, like that. The reason is they are planning for a baby. The planned baby is such where they know, and then when they are happily married, first of all, they are planning for a baby, that yes, now my life will be changing a lot. And it's not me, it's a father, mother, baby. It's like a whole, like a triangle, or it's like a circle which is going to come up in the life, and the life is changing. So they are physically, mentally prepared. Secondly, if they're too much professionals, like medical life is, of course, a complete professional life. That way, the people are on a very upper grade level of their professionalism. Then, in that sense as well, they know that here are the people who are looking at the, who are looking at a complete circle of the family life, and then they know that how to find the vacuum, how to adjust. So it's, this, I would rather say that this is one class of a people. They will know how to adjust. Sometimes they don't know if it's unplanned baby. At that time, their life is messed up. Because or supposing even if they have planned, but in spite of all that, they haven't thought that it's going to be this difficult, because it's a first child or a second child or whatever may be the case it is. But this is a common factor in the life of the couple. Secondly, in underdeveloped illiteracy. And then secondly, I would rather say into upper grade, or those like a well-developed country and upgrade society, that they are ready to fight any diversities like abuse or environmental or a social. There are a lot of bondings, but they are totally not considering all those kind of the obstacles, because they are not bothered for those obstacles, because they know how to tackle, and they are being tackling so far, because they are facing in their professional life, in their upper grade life, when they are growing to that stage of the life. But the marriage is very happily and sustained, so they can afford to fight out with those kind of the obstacles. So they are not concerned, they are not bothered for that. They are bothered about how to look after. It's a nurturing, because they haven't done. They're like, they're brought up in the lavish kind of uh, precious kind of the life. So they are just like, dum dum dum, go ahead and do the job. That's one kind of a society. So they are over concerned about inadequacy caring of the baby. And that's why they are little bit timid kind of a people. But one kind of a people, they are having the social problem, environmental problem, another, the physiological problem, like those kind of a people, they are nearly in an underdeveloped country, in socially and economically little bit lower grade kind of a thing, little illiteracy or illiterate kind of a class. of a people, or they have got a series of many children and those kind of a people. Secondly, they are the class of a people who are uh, who are abused a lot, maybe in a childhood, maybe by the society, maybe by the family. So it's an abusive kind of a nature. And they are always been concerned and always been living in a stressful position all throughout. See, these kind of a people are considered as nearly 25 to 26%. And those are the one in this kind, they are facing a lot of these kind of a depression, because for them they have got inadequacy of a finance, or maybe they are not fit to fight with the society. That's why I said about the self-esteem is going away, means your mental motivation and self-confidence is not there with you. So these kind of a people, they are facing a lot of hassles and problems. Secondly, behavior. Behavior is also very, very important, because accordingly that your behavior, you show a lot of symptoms and changes. Now, remember these kind of people who are abused and who are having a trouble. Not only that, they are already gone and undergone, but they are brought out maybe in a self substance abuse, like a cigarette smoking, drug abusing, all of those who are vulnerable, who are who has seen life from the childhood, a lot of fight in the family, lot of problems within the family, and those kind of a thing, people or a children who are brought up with all those dilemmas. The people, the mother and a father, they always fight for a drinking problems. Then these is all the things which is there, arguments, all that things. Like, I would rather say these is a family violence. This is one of the factor which has been said, but it is true. That is one of the factor which affects in a long run for this depression, because what they want is that what the father or a mother, any of them, they don't want the child to go through that, but they are not adequate, they are not they can't give that, because they don't have that what they have gone through, they don't want the child to go through. So this is where a post depression starts. And that is why they're constantly thinking about that, they constantly worry about that. And that is one of the things which put both of them, father and a mother, especially mother the most, in a depressive manner, especially in underdeveloped country. Mother is a housewife, she doesn't have any outside world to go through, and she hasn't seen it anything, first of it. Secondly, she's illiterate, so she doesn't know what is these kind of a depression is. She doesn't know about the biological cause of all these things. Now, in olden times also this was there, but it wasn't much aware about it. It was not much studied well, these kind of a depressive moment which comes in the life of a mother. And they have got a lot of children, and they have got a lot of care to look after, and so many things are there which is affecting. So this is the one which is affecting in the underdeveloped country. In this kind, especially in connection with the UK, we would rather say the immigration, the people who are coming from a different part of the world, and they are settling here, maybe on the case of the work, or maybe on general way, or whatever. Those kind of a people, they are not much aware of the country, the present country, and they are going through these kind of a depressive moment, because they come with the family and they are not much aware about the life over here. They are coming from the small town, They're ready to fight. They're bold. But that doesn't mean they can do everything like this. And they can't get on with the life easily and very quickly, because the life changes a lot. And the asking of country, law, bylaws, legal requirements, general requirements, family requirements, and you are not in a position to fulfill all of that. So many things are there which is affecting in this country as well, that the women, they undergo with these kind of a depression. Now what happens? How do you show your behavioral changes, your behavior, how it shows? See your symptoms. First of all, you don't go out much. General depression, you don't go out, or whenever you are going out, you don't enjoy yourself. Means having a child is a fun. Having a child is a joy of the life. But what happens when you go out? You feel just sitting quietly. You don't enjoy, you don't play with your baby. You just quietly sit down. First of all, you don't go out only. You don't go and show some sort of a interest in having a new child, something buying. This is all the thing develops when you become a mother. That what I should give a best to my child, what I should do the best to my child, which is a nutritious thing. These kind of interest which develops in mother, but it doesn't develops in the mother who are facing this trouble. Secondly, the husband and a wife, they combine together and they create a lovable integration of the family, which is called as the good coziness of the family, because of the baby, that here is the fruit of our love, fruit of our feelings and our emotions. But you don't feel that happiness. That kind of a happiness is just gone. Thirdly, your food and diet. You feel like having a good food, but instead of that, you go into and you have to take care about your exercises, your diet, because during pregnancy, you are definitely forced to eat a lot, because the child needs a nourishment. So every time you've been told by the doctors and by nurses, midwives, that here you are not one, you're two. So have a good food, have a nutritious food, have a proper food, have a food in the interval. Like quite a lot of things have been told to you. But here now your appetite changes. Sometime what you used to like it, you don't like, or sometime what you should eat, you don't eat. So it's like, a different mix kind of the changes in your food and dietary habits. And you sometimes hog, like overeating, or you don't eat, which is very essential for a child, because you are a milking mother. You do the breastfeeding. So at that time, you need this. Secondly, you feel very lethargic, laziness, tiredness, and it's like a excitement, happiness, which is there. You loses out. The child is just like there, and you got a child. That sort of a thing. It happens in your life, and that is why, because of this lethargic condition, because of the laziness, you don't even look after yourself, because the first 3 4 months, 5 months, 6 months, 1 year, where you have to look after yourself a lot, because the first few is, of course, you'll have a menstrual cycle. Thereafter you will have your slowly and slowly your health is important, which you are not looking at it. Your clothing, your personal hygiene, which is very important to you, which has been neglected. So these kind of a thing which is very important in your life, which gets neglected. Not only that, you don't even do that with the baby too. And that's somewhere you have to think about it. Why like that? Why I'm like that? Even the family members, if any of your daughter-in-law or your family members, like your daughter, or see these, all of them, your sister, they all show some these kind of a behavior and these kind of a symptoms where you find it little bit unnatural, please contact GP, because this is one kind of a thing. And why it is happening, correlate. I'm going to tell you why it happens, the reason of this as well. It has got a biological reason as well. It's a genetic reason as well. Which I'll tell you one after the other. I'm taking this step because this is a very unusual kind of a thing. And we had a case here, and me and Dr. Neha was discussing, I think last year, about this. It went far up and up above. So these kind of things are happening in UK very, very often, especially in our Asian women. What are the reasons? Which I'm going to talk to you, because the Asian women are facing a lot of trouble. English women are facing a different trouble because it's all the different ways that it is happening. And of course, a man too, I'm going to, because it's a correlation of a man and a woman, and they both are going through this. Psychosis is a different, but this depression is a different. Then you don't feel like mixing with the family members. You don't try to talk much with the family members. When generally family members talk about the child, because there's a new arrival in the house, so they will definitely chat with you. How's the child? What is he doing? Is he bouncing? Is he this? Is he that? And your answers are, okay, okay, this, that, like a short answers. Think of that. Yeah, okay, going on, this, that, your interest is lacking. Then think about it, that there is a difference. Generally, a man and a woman, they both are interested, they both like to talk, they both like to share their joy, and especially with your mother, father, your friend, your circle, who are your very much adorable cousins, and your very close people. With those people, you definitely feel like sharing and cherishing these kind of a moment, a single moment of the child where they say dada, mama, these kind of a thing, or when they start crawling, when they start sitting, when they start teething, these kind of a thing, the toddler thing, toddlers conditions, and the mischievous eyes and nature. These are very simple, minute things are there, but you feel like talking about it, which you don't do it. And that's where you have to think about it. If they don't realize, the people who are talking, people who are trying to be around, they should be little bit careful, and they should think that there is something wrong. Now we must talk to them in a different way, and we can take the advice of the GP. Number three is the sleepless condition. Normally, what happens when the child is there? The child doesn't sleep in the night time. So one or the other, father or a mother, they remain awake. They try to give them the best, and they try to make them sleep. And all those things are common, we try to do everything like that for a child. But what happens here? It is the parents, and thereafter you get tired. So because of the tired conditions, you should also be sleeping in the daytime or in the afternoon, because you are given a special holidays, or you take a holidays, like first 3-4 months, which are very crucial for a child. But what happens here? Instead, the parents, they don't feel sleepy at all. It's like they don't feel sleep at all. That's the thing happen. Or whether child is crying or what, the parents, they go to sleep a lot. They're not concerned about the cry or a sleepless condition of the child. So there are two totally negative side of the things. One is excessive, one is totally zero. In a sleeping position, it's not a medium. Like, because the child is awake, is crying, you looked after it, and then when the child is, like a lullaby, sleeping, these, that, and patching, and thereafter, you also feel sleepy. Sometimes I've seen the mother, they sleep with the child in a lap and they keep on patching as well. So these are the things which is common. This is a natural. But when it comes to extreme, that the child goes to sleep, but the mother or a father doesn't feel sleepy at all. Or whether child is crying or sleeping or not, the mother and a father, they are asleep. Oh, let it be. I've given them the baby hot and they are sleeping. So I need to sleep. I need my sleep. I can't get on with that. And that they sleep like as if they have done everything finished with them. And they sleep like a snoring sleep, that sort of a sleep they have. And that's an excess. Or instead of a 7 hour sleep, they have an excess of say 10 to 12 hours sleep. So these are the ways that they go to bed. This is a behavior change. And these are the changes when you show. Then think that there is some kind of changes that you have when you have a baby, and the family members also should note these kind of a change, and then they can report it to them. They can report it to the doctor. They can discuss within the family that why like that. Now, this is one kind of a thing which is there. Now, what are the reasons? This is not always been happening most of the time like a consistent, but it happens with the maybe sometime it happens like in a day or so, or in a week it happens 4 5 times or so. And then these kind of episodes, when it happens, you have to think that there is somewhere something which is not right. And this is mainly happening from birth of the child till 6 months. And slowly it decreases and goes away. Now, see, the thing is, this is what happens and what are the results of this and what causes this. The people who are abused, they are first. Second, there is a changes in the hormones. When I was taking the lecture on the hormones, I was telling you that estrogen and estradiol, it's a one part of the hormone which is there. When I was taking a lecture about the stress, I was talking about the hypothalamus, pituitary, and adrenal circle and the cycle. I was talking about all that kind of a thing. Hormones, they play enormous role here in this kind. This is a hormonal disturbance. It's not only for the lady, even it happens with the man as well. Because here, when you are pregnant, your cycles are changing completely. Because, as I said, when pregnancy consideration, your progesterone, estrogen, and these and that, and I think I gave you the whole cyclic that what happens when you are conceiving your baby. When I was taking my women's health lecture. So at the same time, when you are after pregnancy, I said that they need to come back to the normalization in the normal condition, that the woman can get her monthly cycle, a man can have their complete routine cycle with them, because it's the interactions in between. Man doesn't have gone through much with it, but they do have gone through after that with the stress, because now the pregnancy, so the burden that they will have mentally, that has put them into certain levels of the problems. and the cycle changes. Women in the after 9 months, this is the cycle changes of the normalization. And there they have, if there is little up and down of the cycle, the hormonal disturbance, then you are bound to get a problem with the estradiol, and there certain kind of the neurotransmission activity affects, and you are bound to get these kind of the troubles. Now, secondly, the people who has got the bipolar, people who are diagnosed with the bipolar, it's a biological. I always tell you certain genetical and biological things are such. Some of the people who are having a depression, it's a inherited depression. Then they are the people, they are bound to get these kind of a thing, which is very, very normal, or they have got a very high risk of having this postnatal or a postpartum depression. Bipolarism is, of course, a genetic, and it comes by the father or a mother of their relatives. If the father and mother are not affected, it doesn't mean, but in your family, if anyone has got that, then make sure your child has got a little high risk of this kind of a thing. Secondly, if you have got a substance abuse, if you're vulnerable, if you are, like you are in a child care and you are an alcoholic, you haven't taken care while having a baby, while you are having a pregnancy, about the alcoholism and all that, at that time you're bound to have these kind of a trouble. So make sure of all these things, that these kind of a thing, and we always advise that avoid alcohol. Cigarette smoking is another dangerous. Nicotine. Then, some people, they go for a shishas, and nowadays these are the another thing. Then they go with the, the vapes and all that. This is also no good. When you are pregnant, please try to avoid all those things. These are the new things which is coming up in the market. Secondly, lots of caffeine. Avoid lot of caffeine. Caffeinated drinks, lot of caffeinated drinks, lot of fizzy drinks, lot of, junk food, these kind of a thing, they are no good. You are putting lot of artificial material in your tummy, and make sure that is going to go to your child. So be natural, be normal. And these kind of a people, they are having a very high risk of depression. The father things are yet not well defined. Why father fall into postpartum depression? But it's not yet well defined. But still, there are a lot of work still going on, but still many of the father, they get into these depressive conditions and all that. Now, secondly, they have got another thing which is there. It's abuse. The ladies, the children who are childhood abusive conditions, severe abuse in a child when they are severely abused, like hitting, beating, bagging. Then they are having another stage of it is a sexual abuse. These kind of things are there. Then the children, they are, always being kept with a stressful position. Those children, when they grow up, their brain is not that strong enough. Their personality is different. And that people, those kind of people are bound. Even a Man is bound to get this. This has been predicted that these kind of a man can have the depressive condition. And a way, ladies as well is bound to have the depressive condition. So, ladies, of course, they are always remaining and keep on thinking about the past because of that traumatic events in the life. So, please, these kind of a ladies are also bound to get the postpartum problems. So, what my question is, today we have taken some part of the problems of the postpartum and the real reason, the causing of this, the neurotransmission activity. So it's a biological. Biologically, the hormones are changing. Biologically, socially, you are facing a problems if in your past life you have gone through. Thirdly, your habits and unexpected, antisocial behavior or unexpected or antisocial habits of the person and violence, arguments, all of that. These are all the parts which are creating a lot of disturbances in your life. And then your life is totally with the, because and why it is like that? I will tell you in a simple one. The socially, you are always, especially ladies, in the rural areas, they are always living in stress. Oh, get up early in the morning, give the is in a underdeveloped country, in a rural areas, they are first of all financially not equipped. They are not well qualified. They are not much aware about this kind of a thing, whether it is happening or not. So for them, and whether their parental care, these that they're not bothered about it. So this has been seen in those kind of the areas the most. Secondly, in developed countries, the overwhelming, overcaring, it's like excessive, and that is why this depression is found. And the coping up power, both of them, they can't cope up with them because one side they have got many children and the responsibility, here the other factors affect. So both the places, the depressive stages where the abusive conditions are such which are affecting and the social surroundings, environmental, where the everyday night, in the rural area where we come up, even here also, it's not like that, it is not hidden. The father comes with the drinking mood, they always think, oh, the wife is like that. So it's like considering the wife as rubbish of the dustbin, though she's a pregnant, but they don't bother for the wife. They just bother what they want, they need to have it. And that's where these kind of a thing, the women, they are literally and consistently throughout their pregnancy life, they are living in a stressful position. And this stress is pushing them into the depressive condition after. That if I'm like that, and thereafter the child comes. So, her interest of having a child, having a baby goes away. In this, secondly, the superstitious conditions of the surroundings. Oh, you should have a child. You can't go for abortion. You can't do this. You can't have that way. Even if it's a fourth or a fifth child, the father or a family members, they wouldn't like to, because against the religion or against like that, and God has, so many things are there, the superstitious things are there in the people. They don't look at the condition of the mother, they don't look at the health, but they just look at these kind of factors as well. So there are many things which are there. These are affecting a lady a lot. And then they are the one. So I'm going to take a lot of things which are there. Secondly, some of the diseases which are also creating a risk factors, like a fibromyalgia. What is a fibromyalgia happening? We have done Arogyam a lot about it. It's a severe pain in a body. But that is for what? Traumatic condition. A constant severe traumatic condition. And why the trauma happens? As I said, the abuse. So when you have got these kind of a thing, you're bound to have this postpartum depression. Secondly, if you have got the history in your family, someone had it, then you can have it as well. So it's a history, genetics, which tells you. And as I said, schizophrenic, bipolarism, these are all the risk factors. The behavior, the generalized anxiety, a generalized depression, so many of the depressive condition, the traumatic condition, somatic depression, somatic depressive conditions, they are all resulting into the vulnerability of the children, the inadequate child care, any child care centers, all of that, they all create a lot of problems with this. And some of the asthmatic conditions. So, like these are routine things which will put you to this postnatal or the postpartum depression. Now, let's take it over with some of the medications. They also put you to the postpartum depression. Like, you are taking some of the medications like which is responsible to create a labor, then those medications also sometimes they do give you these feelings, but then it goes off very quickly. It is not that dangerous, but this they do have it. Now, what is the another thing? There are medications, there are treatment. The treatment are like, they give you cognitive therapy, they give you interpersonal therapies like a talking, they give counseling is there. That nowadays in rural areas, in underdeveloped countries, these things far behind that you can have certain families who doesn't bother, who doesn't know about such things. For them also this is far behind. But having said that, this is one of the where we can have non-pharmacological treatment given cognitive therapy, interpersonal therapy, psychological awareness programs are there where we take the people and train them were there adequate, and there are so many rehabilitation kind of a technologies or a guidelines are there, government guidelines is there, that if you have got something like this, how even during pregnancy now even during pregnancy time, the children or the mother and a father, they are given a complete knowledge about the postpartum, what is a postpartum. But that is why the rate of this postpartum depression is reduced. And doctors are looking at very carefully if you have got a child and if your history suggests something like this, then they literally look after you as a mother and a father too. But basically speaking, there are medications which are there for antidepressants, but that should be given when it is necessary. If you can come out without any medications, there are serotonin reuptake. This is one kind of, I'm talking in a medical terms, but those medications are there. I'm not saying no, but at one stage, not necessary if you can get on with this with non-pharmacological or non-medical point of view. Okay, so I would rather suggest any of them have got any questions in this particular postpartum or a postnatal if you have gone through, and if you need it now, what to be done, because that will affect even your menopause or maybe your after menopause systems and all that. So we can have, yes. um, Generally, these kind of a thing is not aware. But if you have got any problem, and if it continues, it always generally remains for 3 to 6 months. But if it continues for more than that, then better contact GP and say that this is a baby I have and I'm not going ahead with this. I'm facing these symptoms and there are medications. Antidepressants are there which can be given to the mother so she can balance herself, and slowly a mother is being brought out of these antidepressants and she can be transformed into a regular life. So there is a regular life. It's not like that. But you can look after baby very well and you can look after yourself elsewhere. But see, after 3 to 6 months, if in 3 months, if you show something like that, please, please go ahead and talk to your GP that I have got a child, but instead of a joy, these are my symptoms and I'm showing this. So have I got something abnormal which is not being seen in generally by the, which is not seen in general in a woman? And then GP will be able to tell you about it. So please go through this. There are medications. Nothing is impossible. Mother can enjoy her motherhood conditions and motherhoodness. Father definitely can enjoy his fatherhoodness. But if any of you are facing, for a father, it's a very less evidences and things are available. But for a mother, the researches are being done the most. And if you have got a fibromyalgia, these, that, then be open with your family history as well to the GP and around, because that kind of a thing can also have one of the reason. If you have got a bowel syndrome means you got a constipation or you get an irritation in a bowel and all that. So that kind of a thing can also have this. Be careful and talk to your GP if you have got a problem. In maybe as soon as the child is born and in a month and all that, if you start feeling like any of these kind of a thing, please get on and go ahead with the GP. Any of them, they have got any trouble and questions, please? This is a very important and unusual kind of a thing, which is a depression that we can have. So I would rather conclude this one and I can over it to the Dr. Neha so she can discontinue.